Hello everyone, my name is Hyun. I am Data and AI Technical Architect at MTC in Seattle. Today, I'd like to show a demo how to use LLM to simulate a conversation between doctor and a patient. So this simulation can be useful for doctors who wants to practice their communication skills, learn how to ask effective questions, and empathize with their patients. So it can be also helpful for doctors for preparing different situation scenarios. For example, diagnosing a conditions, explaining a treatment, or delivering a bad news. So in order to simulate those situations, use LLM, I had to use a couple of different prompts. So before I show you a demo, I'd like to walk you through what are the different prompts and how these prompts are playing in the role in this simulation. So first prompt I use is to create a virtual patient. So in order to describe the situation in detail, I have to ask LLM to generate a random patient profile that includes name, age, ethnicity, gender, diagnosis result, and medical history. Especially diagnosis result and medical history, there have to be a correlation. So I asked LLM to come up with a some relation between these two information. And based on this patient profile, I used DALI to create an image of a patient. So this is an example. So I use this in the prompt here that highlighted up. And then these are the result that I was able to get from the DALI. Of course, I used a different prompt for this, the last image. And after generating random patients with a random demographic, with a random diagnosis result with a medical history, I use LLM to simulate the conversation. So LLM will play a role as a patient, and the user will be a doctor. Since this simulation is designed to help the doctors to practice communication skills, or learn how to ask effective questions and how to have empathize communication skills. Therefore, the LLM will be a patient and the user will be a doctor. So in the meta prompt, there will be instructions with details, but also there will be a patient's profile that is generated from the previous prompt. And after this, there will be a simulation, the conversation between the LLM and doctors. And there will be a certain point where the training or simulation is stops. So once the simulation is stopped, the LLM will read the conversation, especially will focus on doctor's comments, or in other words, the user's inputs, to review by using following measurements. So whether the doctor clearly explained the result, whether the doctor showed the empathy, and etc. So not only evaluating using those measurements, but also there should be a recommendation so that the doctor or trainees have a chance to improve or understand what are the ways to improve their conversation skills. So I implement this web to showcase the simulation, but I want to show a code with a meta prompt before I show the demo. So this is the code that is running to generate the patient profile. So patient profile will include those in the demographic informations, and I gave a couple of examples to the LLM. So LLM will respond back to me, and then there will be a different name, age, and etc. And based on this profile, I use this prompt to create a patient image. So whenever the user, the trainee, use this application, there will be a new patient with a new profile image. So the patient profile will be created with a random condition, meaning there will be random disease or diagnosis result. And after the patient profile is being created, we are going to start the conversation. So I, as a user, will be a doctor, and then LLM will role play as a patient. So as a patient, the LLM may express or have some emotional response. They may have surprise, denial, anger, sadness, fear, and etc. So during the simulation, especially between the start and stop, so the simulation will start with the command calling commencing simulation and be stopped with the command stop simulation. So in between, there should be a flow of a conversation, and I had to give a guidelines to LLM to be more realistic. So dialogue between this commencing and stop simulation, the bot will respond to user who is informing a diagnosis result. And of course, the response could be, may include some anger, sadness, or maybe not response to the doctor for some time. And after this conversation is done, the user can type or input stop simulation, and then LLM will review the conversation. So LLM will focus on the inputs, which typed by the doctor or the user, and then we'll use those measurements and then give us a result back to us. And of course, not only this measurement, but also there will be the recommendation for the user so that the users can improve the communication skills. Okay, with that, now let's jump into the demo. So I use Python and GPT-4 to build these applications. So let's imagine a situation where a patient just walk into doctor office, or maybe doctor just walk in the room to start the conversation. So we just met again after this test. So I'll start say hello, and typically we just make sure the name and date of birth to identify the patient. Okay, so I as our name and then date of birth, and then we have a patient here. So probably before I share the result, probably I'll ask our emotion. So I ask how to feel today, and experience occasional headache. So still she's experiencing the headache, and then having issue with her vision. So she's wants to know what is going to her. Maybe I can ask other symptoms. Okay, she haven't noticed any other symptoms. So we took the test, and here's the result. Unfortunately, the result came with the early stage glaucoma. So with this response, seems like she knows what the glaucoma is, but let me make sure. Okay, I'm going to explain, but on purpose, I'm going to use a lot of medical term to explain the disease. Okay. Fortunately, looks like she understand the situation, but kept saying emotions. And then maybe I can tell her what are the next step to treat. So treatment is here is the sample. So I'm going to copy and paste treatment. Okay, so she expressed some hope there. I think the conversation is will go on, but in order to show the result here, I'm going to stop the simulation. And with that, the LLM now read the conversation from the beginning to the end, and then came up with the score and the recommendation. So the situation was the patient who is Patricia, 44-year-old, who diagnosed as an early stage glaucoma. And the conversation overall, patient seems understood the situation. I think everything is good, but use of medical jargon is 65% score, so out of 100, I presume, which means I should have used more plain English to explain the situation, minimize the medical terminology terms for patients. Okay, so this is one of the case. If we rerun, we execute this simulation, we may have a different situation, different patient with a different diagnosis result. But the goal is, give a chance to doctor or caregivers who wants to practice how to communicate with their patients with the empathy. Okay, this is the all of the demo. I hope it was useful. Thank you for your time.